The Bright Ideas project itself is a research project which is interviewing service users, carers and professionals across the NTW patch, which is Northumberland Tyne Mental Health Trust, to determine if there's a pathway to recovery through care coordination.
So the bright idea is to come up with a game on a 3D mobile device. So we're using a tablet computer called NEO 3DO, and on that we're developing a game to help children with binocular vision disorders like squint or lazy eye, essentially, and so they can't perceive depth as well as people without the condition. So the game is to help treat and potentially identify even these vision disorders for young children between the ages of 3 and 10.
Alongside Julia Newton in the university, we developed something called a MOOC, which is a massive open online course, and it's called Aging Well Falls. And the point of it is to educate and empower people who have fallen or are at risk of falling in order to try and help them help themselves have any to prevent having further falls.
So our big idea is around taking patient and public involvement in research from something that can sometimes feel a little bit like a token gesture of patients being involved in looking at materials and advising on projects, into something that's a much bigger process involving the patients in the whole project, and really embedding them into the research team and having a much more focused approach.